Can you just explain to people, Simon, sorry to interrupt, when we say robotics, and I think sometimes people get this vision, it's almost as though, when I first heard about it, I naively had this vision of it's a bit like, on the car manufacturer conveyor belt where there's robots coming, zip, 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 and they're doing surgery, and then you're just sitting there just having a cup of coffee.
Having a cup of coffee. Oh, if only it were that way.
And that's obviously not the case. So can you explain to people what the robot actually does or doesn't do?
Yeah. So the idea of a robot in knee replacement surgery is to try and improve the accuracy of where we cut the bone. You have to cut out bits of bone so that you can fit in the new artificial knee joint.
Yeah.
And the traditional way of doing that is during the operation using what we call alignment devices. So metal rods inserted into the bone and jigs that are attached to those rods temporarily to identify where the cuts are made. But those are reliant on how well the rod fits in the bone, and there's always a bit of give and play with those devices. The idea of a robot is it's a bit like that sort of what you said in the car factory. It's a mechanical arm that's attached to a large robotic device, the computer, as it were. And this robotic arm comes into the field of surgery. The surgeon holds the robotic arm, and the idea of this system is that the robot, in advance of starting the cutting of the bone, the robot recognizes and registers the shape of the bone that you're about to cut and calculates where you should remove bone and where you shouldn't remove bone. And the robotic arm will have maybe a sawing device attached to it, or quite often a burring device, so a high-speed burr. And the surgeon grabs hold of this robotic arm, and the robotic arm will only move in certain areas. If the surgeon keeps to the area where the bone has to be removed, the robot lets you do it. But the robot stops you from swinging the arm out of that region of cutting. So that's the theory. So it's reliant on the robot being able to register details of the bone, whether that's a scan that's been uploaded prior to surgery, or whether it's actually, quite commonly, the robot's system. You start the operation by taking some time to register surface landmarks of the bone. The robot recognizes those surface landmarks and then equates that to what the scan before the surgery showed up, and therefore calculates what bone needs to be removed and what bone needs to be preserved.
So in theory, it's trying to take sort of the chance of human error out.
Exactly. Now, the problems with robotic surgery are that it's very expensive equipment. You might spend £1 million buying a robot, and especially in the NHS, you have to be able to justify that sort of expenditure to decide whether it's actually going to make a significant difference to outcomes. And that's what's difficult. Trying to measure these outcome variables can be very difficult. So there are alternatives. Personally, I don't use robotic surgery. I've used navigation for knee replacements before, and that's something like what I described before. There's a robot in the operating theatre, and you spend some time recording data points on the bone, and then the robot guides you. It won't actually stop you from making a wrong cut like the robot does, but the computer shows you where the accurate alignment is. And that's a well tried and tested system that works well. It adds surgical time. If you're trying to get a good outcome from a knee replacement, you could spend hours trying to finesse your preparations to the perfect level, but that may not actually result in a better outcome for the patient, because the longer the surgery goes on, there are other side effects of that: bleeding, risk of infection. So again, it's a balancing act.